treated them well and discharged them, and the babies are doing exceptionally well. Receiving a child, a newborn, with a very specific heart condition, which was considered to be treated by very different methods earlier on. But today a new method has been tried, and the child is doing exceptionally well. And that is what we are going to. Our entire focus is to try and bring in newer technology, newer clinical practices to try and improve this space and deliver better results. As all of you are aware, Motherhood started, is a very young organization. When it was during the inception, it was about 3 hospitals out of Bangalore. And in the last 5 years, we have made very rapid progress. And today we are present in 8 cities across the country, and we have 17 hospitals. And we would be probably becoming an in Bangalore. The entire objective of growth and entire objective of expansion, the larger cost and larger benefit of this country and the children of this country. So without taking much time.
Its services and support across the region of Karnataka.
We have very senior, very well qualified, which are very well equipped to take care of these sick newborns. And we also conduct a PG training program, for postgraduate medical students across the network for training in neonatology. So this is where we are in terms of the network. Coming specifically to Bangalore, Dr. Pratap, Dr. Suresh, Dr. Deepa and their team have been doing an incredible job in terms of not just treating the newborns, but recovering them and treating them from far-flung areas, really far away from Bangalore. As is evident from this graphic here, they have a robust program of ambulance on wheels, which caters to far-flung areas, even 500 kilometers away from Bangalore.
This case was one of the most challenging cases of my career. Baby of Sumalata, who was referred to us from Anantapur. What is special about it? They thought the baby's heart was racing very high. And when the baby was delivered, they also noticed that the heart rate of the baby was around 250 to 280. Because if your heart is beating that fast for a longer period of time, then your heart tends to fail. So this baby was referred to Hrudaya Hospital in Anantapur from RDT Hospital for a better care. And there, this case was one of the most challenging cases of my career. Baby of Sumalata, who was referred to us from Anantapur. What is special about it? And when the baby was delivered, they also noticed that the heart rate of the baby was around 250 to 280. Because if your heart is beating that fast for a longer period of time, then your heart tends to fail. So this baby was referred to Hrudaya Hospital in Anantapur from RDT Hospital for a better care. And there,
SVT is very rare. We get SVT, but some electrolyte imbalances and some conduction defects or some sepsis can cause SVT, but even that is very rare. I think I have seen 2-3 cases of SVT in newborns. Okay, pediatric we see some cases. And the line of treatment is adenosine, and which is given at RDT that come to Hrudaya Hospital for the further treatment.
So after giving the drug, usually the heart rate will come back to normal. However, it did not happen in our baby's case.
But the heart rate is already too high, and already injection adenosine was given. So the next line of treatment is very complicated. That needs some cardiac monitoring and cardiologist opinions, all this, which is not possible at Anantapur. So we shifted the child to Motherhood Hospital.
Our ambulance set off within 15 to 20 minutes after receiving the phone call. The baby was met at Chikbalapur, which is almost like halfway through from Bangalore to Anantapur. And instead of just bringing the baby, because we can do majority of the things that can be done in the NICU itself, we started establishing this condition.
రోజు మాకి పొద్దున 10 గంటలకి కౌన్సిలింగ్ చేసేవాడు సార్, మీ బేబీ కండిషన్ ఎట్లుంది అని. మన సారు బాగా చేసి 3 రాష్ట్రాలలో వేరే దేశం వాళ్ళు కూడా పిలిచి మీ బేబీకి ట్రీట్మెంట్ చేపిస్తున్నానయ్యా.
We made sure the echocardiography is done immediately and made sure the structure of the heart is all right. And then we did a lot of continuous ECG monitoring to understand the type of rhythm that we are dealing with, to make sure our diagnosis of SVT is actually the correct diagnosis. Involved the cardiologist and the cardiothoracic team and discussed quite a lot about the case. So almost 24 hours passed by and we were not getting any response. Okay, that is being done in the adult world, stroke treatment manake, and bring the rhythm back. That is the first one, which is called the vagal maneuvers. Second one is what the medications that I suggested. Adenosine is still the drug of choice even in the pediatric age group. And adikinta jasti hogta idre, then you are getting into the realm of beta blockers, amiodarone, flecainide. The reason when it goes illness, maybe another 1 month, 2 months later, and a viral illness can trigger this, or if a child becomes... Hello everybody, I'm Dr. Pratap Chandra. I'm a neonatologist and consultant lead at Motherhood Hospital, Bangalore. This case is about a baby who was delivered almost about 250 kilometers away from Bangalore in Andhra Pradesh. And this baby was noted to have a very racing heart, a very high heart rate of about 250 to 280 per minute. Normally, a newborn babies would have a heart rate of around 120 to 160. So this heart rate being so high is called Supraventricular Tachycardia, SVT in short. So babies, when their heart rate is going so high for a long period of time, they can have heart failure and then the heart will fail to pump the blood, and then a lot of these babies can die. The treatment for this is medical treatment. You are giving medications called adenosine. In some cases, if it is not treatable with that, you keep giving more medications, for example, amiodarone, beta blockers, flecainide. So there are a lot of other medications that can be given. In our case specifically, what happened, the baby did not respond to any of the medical treatment. So we waited for a little bit longer for the medicines to work, only because the baby's heart was good and functioning well. By second day onwards, we started noticing the heart was actually failing. The ventricular contractions were becoming weaker. So this is a time where we have to step in and then gave what is called as a shock treatment for the baby. So we administered 3 doses of shock treatment, and in spite of that, the baby's heart did not come back to normal. So when we give a shock therapy, usually the heart will stop for a fraction of a second and it will restart. It is like booting the computer basically. So when the heart restarts, generally it will go back to normal rhythm. So in this case, it did not go back to normal rhythm. So this is when there is a baby where you have tried a lot of medical treatment, you've tried giving shock to the baby, and heart is not functioning well. This is when we had to go out of the box and then think about a novel therapy which can be used in order to save the baby. So this is when we administered a therapy called total body cooling, where the baby's temperature is brought down to about 33.5 degrees in order to make sure that the heart rate comes down. So by God's grace, it did happen. 4 to 6 hours after starting the treatment, the heart rate started getting better and all the rhythm came back to normal rhythm. And we had to maintain this for some more time and make sure that the heart goes back to normal function. Then we started rewarming this baby very, very slowly, because if you're starting to rewarm, sometimes the rhythm will come back to the SVT. So luckily that did not happen. And then once we stopped the therapy, the baby's heart was functioning normally and it had a normal heart rate of about 130 to 140, and then the rhythm of the heart was also normal. And then the baby was maintained on 3 medications for a period of about 1 month, sent back to where it came back from, and had a connection with the doctors there, continued the medical treatment in Anantapur, that's where the baby came from, and then made sure after 1 month we stopped all the medications. So we reviewed the baby after about 6 weeks. We repeated the ultrasound scan of the heart, and we were very, very happy to say that the heart was functioning normally and then the rhythm was also normal. And this baby girl was a bundle of joy
to actually look at.